Tonight's speaker is Dr. Chance Armstrong. Dr. Armstrong is part of the food animal faculty at Louisiana State University. His interests include herd health preventative management, urogenital surgery, and advanced reproductive techniques of food animals. In 2018, Dr. Armstrong co-authored the second edition of the Bull Breeding Soundness Manual. I will turn the mic over to you, Dr. Armstrong, to tell us all of the good background stories.
Thank you, Carla. I appreciate it. I hope everybody can hear me just fine. Very honored and humbled to be asked to do this by the Society for Theriogenology, and also supported here by Vin tonight. And also thank you all for choosing to spend an hour with me late in your evening here. I'm sure you're all tired from a long day in the clinic and trying to get on to other things. But hopefully my goal is to have something worthwhile that you can take to your practice tomorrow that's going to benefit your clients and your patients alike when we're talking about the subject of infectious bovine infertility. I always like to know who's talking to me when I'm getting some CE. And so here's a little about background. I'm from a small town in southeast Alabama. I was raised on a cow-calf operation there. We have a commercial herd that we still maintain today and have some raise some peanuts, and also have about 12 broiler houses there. So it works nice together in that diverse farming operation. Was fortunate enough to reach my dreams and always to become an Auburn veterinarian. I went to undergrad there and in pre-vet and got a minor in poultry science. I went on to veterinary school there. Upon graduation, I joined a 5-doctor mixed practice in South Central Florida. Very rich history there of ranching, and was able to work on some of the largest ranches in the country there. In Okeechobee, Florida. I learned a tremendous amount there about the cattle industry, and still very proud to be a part of that community. I was able to come back and do residency training and also attain a master's of science degree at Auburn, studying Tritrichomonas fetus. Really got my interest in Tritrichomonas fetus when I saw it firsthand in some of the ranches that I served in the endemic South Central Florida area there, with Tritrichomonas was very prevalent. And got boarded there. I've been on here at LSU since my residency as a large animal faculty member. So a little bit about me. Let's jump right into it. First thing I like to always talk about, let's define what we're really talking about with infertility, meaning the medical dictionary, Dorland's medical dictionary, defines as infertility as not fruitful or the absence of ability to conceive or induce conception. We see this on an individual animal level, but we also see it in populations of animals. But truly, subfertilities, when we talk about bulls, that's what we often see more frequently than infertility, where he's not going to produce any offspring, where we get diminished offspring production or lack of reproductive efficiency, if you will. In litter-bearing species, this is one of my mentors, Dr. Dan Gibbons, who some of you may know. He presents it as reduced pregnancy rates or decreased litter size in litter-bearing species. And then let's talk about venereal diseases. And it's pretty much what everybody knows, but the transmission is going to be due to and propagated by sexual intercourse, which we're going to talk extensively about during the first part of our discussion tonight. Okay, we got a poll here. Carla, are you doing the poll?
Yep, that's going up. We'll give folks about 30 seconds or so to answer. And there's your results.
Okay, so most of you, just a little bit. So we'll become much more familiar tonight with venereal disease. Let's talk about all the different causes, or just an overview of all the different causes of infectious infertility in the bovine. Lots of things we could talk about. With the amount of time that we have together tonight, I thought we'd focus on just a few. So I'm gonna focus on a bacterial component, infertility of Campylobacter fetus subspecies venerealis, and then Trichomonas fetus being a protozoan pathogen that causes significant infertility in cattle, and especially in natural service herds, which encompass most of the beef industry in the United States still. Then we're going to talk about two viruses, both bovine herpesvirus 1 and also BVDV at the last part of the session here. Of course, there's much more we could talk about, but we just don't have time. So when I talk about Trichomonas fetus and Campylobacter fetus subspecies venerealis, or otherwise known by lay people as Vibrio, and you'll still see that on some of these multivalent vaccines. The V stands for Vibrio. That's just an old terminology that has gone by the wayside that we now call Campylobacter as far as the genus. They're the two true venereal diseases. That's kind of hard to get out, but the ones that we think is true venereal diseases, meaning this is the really only mode of transmission that our primary mode of transmission for these two disease processes. So we're going to get coitus, and the bull and the cow are both efficient at transferring this back to one another. You can get some AI contamination if you had you had equipment that was not cleaned properly. We really don't see that problem anymore. A lot of these facilities are so biosecure and clean with their procedures as far as collection of bulls, or also when we're using a single-use pipettes for insemination of cattle. We just don't see this mode of transmission to be a big problem anymore. And this is definitely a bigger problem in beef versus dairy, because of the use of artificial insemination in the dairy industry is much more widespread than in the beef industry still today. So we're going to first talk about the protozoan. The parasite is actually Trichomonas fetus, as you can see. I love this picture. It is an anaerobic protozoan, and it has two forms. Okay, it has a trophozoite form, which we see in this picture here, right next to this bovine spermatozoa. It's a little bit larger than the bovine spermatozoa. And you have these undulating membranes. It's very characteristic that actually give the forward motility to this organism. It has 4 total flagellum, 3 anterior and 1 posterior flagellum. And we always thought, before I was educated on this, I thought, well, that's just kind of the rudder back there that's causing but actually it's the characteristic undulating membrane of this organism that causes that. We call it trichomoniasis. And then the lay term, is usually, we call that trick. The pseudocyst form, we thought for the longest time was a degenerative form, but it's actually not. It's something where we internalize the flagellum during times of poor temperature conditions inside the prepuce, where we get this morphologic transformation and actually can undergo mitosis. It does have it's the reason why it's called a pseudocyst, because it has a compact non-modal form, without a true cyst wall. And again, unfavorable conditions within the prepuce and along the dorsum of the penis cause this. And so we also can see through electron microscopy flagella that actually reside within the cytoplasm. And this can reverse very quickly and change with either cooling or warming temperatures within the prepuce, or unfavorable conditions, or when conditions become more favorable, actually we can see a budding process, which I'll show you in the coming slides. This is from a paper in 2003, and we can kind of see through scanning electron microscopy the actual internalization of the flagellum here, as you see up in the left-hand corner, A being the trophozoite, and it's starting to internalize here during unfavorable conditions. and during this process, we can see this budding process where actually 8 trophozoites have been noted in the literature to come from this once conditions are favorable again within the out of this pseudocyst form. So it's actually a way of self-propagation, which we thought initially until we got more discovery with this organism. This organism is super fascinating to me because we still don't know everything there is to really describe this organism, but it really is fascinating in how it's changed. The bull, he is like many venereal diseases, the male is going to be an asymptomatic carrier. You may see, if you're really looking closely, usually with through research, you're going to see mild balanthobusthitis, or usually it's going to be unobserved. We're not going to see any purulent material from the prepuce, any kind of really gross inflammation of this animal, but it loves to localize there in the prepuce. Way back in the 30s, and they've some studies out there that noted that this organism liked to go into the distal urethra, which we found it there before. I had some hypotheses that I thought it might traverse up more proximal in the urogenital tract. We have since not proven that. Other researchers have not proven that. So I got a question mark besides that, because we'll talk about with testing in just a moment why we can't find this organism sometimes, and there's some theories out there, but so far nothing conclusive yet. The sister in humans to this, Trick vaginalis, actually in humans can traverse the urogenital tract in the male and actually cause some prostatitis, but we have not proven that in wholesale in specimens from bulls at this point. We always think about this chronic carrier. If you look into the literature, you'll find that mature bulls are greater than 4 years old are going to be more likely to become chronic carriers than those that are less than 3 years of age. You can see some spontaneous clearance in young bulls. I want to caution you there, though, because clients only hear a few things of what we tell them. To me, a positive bull is a positive bull, and so I want to make sure that I'm doing good testing, and that my samples are good, and that we are using a reliable lab that looks at trick and feels comfortable diagnosing it. But I don't tell those owners with those young bull batteries, if we testing in a young bull less than 3 test positive, that he has a good chance of spontaneously clearing that, even though the literature suggests that some of those bulls will, and some of them simply will not. And the reason why we think that these older bulls, for the longest time, there was a dogma there that there was these preputial crypts, and I call it the crypt conspiracy. Dr. Lou Strickland did his master's work there at Auburn on this, the actual preputial architecture, and did some histology work there. And there's actually those crypts are not actually present. There's a deepening of the folds of the prepuce as the bull ages, because lots of people had suggested that those older bulls had deeper crypts, and that allowed the organism to evade any type of therapeutics that may have been applied topically, but also allowed the kind of hide away from the localized immune response there. But that has been proven not to be true, and so further research is needed in those areas, why those older bulls tend to be more chronic, where younger bulls can actually spontaneously clear sometimes. And that's where we're looking. So that's also a great way to think about where we want to test this bull. He is he's definitely the specimen that we're trying to test, because the cow is a poor specimen as far as the cervicovaginal mucus. Even with different studies I've been a part of, when we're using a clone and placing high numbers of that organism in the cranial vagina, it's difficult to recover sometimes. So some things that we need to understand about T fetus in the female is it does not prevent conception. We do get loss of the conceptus We feel like from an overall inflammation of the reproductive tract, anywhere from 15 to 80 days is most commonly occurs, and rarely beyond 150 days. We do see a period of infertility after that, anywhere from 3 to 6 cycles after that, depending on the cow. But we don't see late-term abortions with this organism. So if you get to 5 months, you can feel safe that maybe you're not dealing with that a trick-infected animal. You're gonna during the transmission of this, if this cow is actually negative, we're gonna have transcervical migration after coitus, where that organism is gonna proliferate and set up shop and cause some local inflammation in the vagina, the cervix, and then eventually endometritis, and we can even have some salpingitis around the ovary because of this organism. Overall, it causes a hostile uterine environment, and we plus or minus will see some discharge from this animal. Usually, in working in the trick endemic area, I did not have that as a complaint by owners. We were working in large herds, but we usually just don't see discharge. Now, the true specimen that you want to actually capture, if you go in and you palpate a cow with a postcoital pyometra, that's not pathognomonic for trick, but it's doggone close. And so I want to be very much curious about that if I diagnose that. So we've got this big fluid-filled uterus with no cardinal signs of pregnancy. I always tell my guys that I'm working with here on the palpation team, I said, don't make that mistake by calling a pyo a pregnancy. And so, but the literature will suggest that 5 to 10% of those cows will develop a postcoital pyometra, and those cows tend to clear it before we're there to actually find evidence of that. But if you find one, I would suggest taking an infusion pipette and traversing that cervix and aspirating some of that fluid to ensure that you're not dealing with trick. And I'll show you a video of one I took off a dairy here in just a few minutes. So what does the owner see? How does he know, or how do you know that you may be dealing with a trick infected herd? So we get a strung out calving season. Cows are going to be returning to estrus, and their interestrus period is going to be prolonged most times, and then lost revenue. Okay, so you're going to have lighter calves. You're going to have most of those calves coming towards the end of the breeding season. You're going to have open cows, loss of genetics there, and possibly loss of bulls because of a positive test. Again, she's going to clear herself, as I mentioned earlier, in several heat cycles, anywhere from 60 to 90 days. And again, we've got short-term immunity up to 15 months after that, after she clears that infection. Skiro in 1987 produced a paper that said that we had a cow that actually carried was infected with trick and carried a pregnancy full term and had the calf. That cow is scary to me simply because if we do everything we can as far as testing and control, then she could be the one to carry that on. And I've actually had this happen to me one time where I recommended that we cull the entire bull battery because the owner was really in tune to cleaning this up on his place. Take it wasn't a big group of cows, but he was pretty upset with me when we bought some new bulls, replaced the entire bull battery, and we had some positive bulls show up the next year. But it was that chronic carrier cow. In 10 cows, it probably doesn't make too much of a difference as far as that less than 1%. But when you're dealing with 15,000 cows, that can make a big deal in large herds. Okay, we've got a little knowledge test here. Looks like everybody's doing pretty good with this one. There really is no approved antimicrobials in the United States. If we were in other countries, that would not be the case. Metronidazole and the imidazoles are highly effective against this organism. However, that is illegal for off-label use in the United States. You'll see some things in the literature if you go and look in there where metronidazole is effective and efficacious, but unfortunately we cannot use that here in the United States. So what do you see also with this normal calving distribution? We should expect about 60 to 65% of those calves coming in the first 21 days of the breeding cycle. If you've got a controlled breeding season and then in turn a controlled calving season with a little over 20 to 24% coming in the second 21 days and then about 8% in the last. So this step method, when I was at Auburn, I lived in a little trailer across the road from the vet school, and I always thought about the normal calving distribution means me coming out of my trailer house and going down the trailer house steps. Okay, and then so overall we should expect in fertile cattle with a bull that's passed the complete breeding sounds evaluation with a good libido, we should expect 90 to 95%, and that's not unreal expectations for what in natural service herds. A trick, what'll kind of clue you in on trick is that this is what we'll see. So just the reverse of that. So reverse calving distribution. So not many calves coming in the first 21 days. Most of the calves, and overall, we're going to have a loss of our total pregnancies much less than 90%. In some naive herds where a trick bull may be introduced, I've seen it drop as low as 55% pregnancy rates. Why do any of them get pregnant, you may ask? It's a great question, and what we must understand is this mechanically is transposed into the cow. And so if a bull breeds 3 cows in one day, that third cow that he breeds may not get a dose or a protozoan transposed into the cranial vagina there. So some of those cows may be spared. Again, it's not going to prevent conception, but it will. Interesting enough, we find a lot of pregnancy losses around day 55, even though that organism is there. It kind of sits there for that long. We don't know why. All of a sudden, it just kind of erupts and gets really upset and causes a lot of inflammation at that day 55 mark. Here's the answer to your question. Again, none are approved. Lots of topical antimicrobials have been tried. They've been dangerous and inconsistent. They've been required many applications, which the critter doesn't like that too much when we have to apply that. And then sometimes it causes scarring, and obviously if we don't have a good delivery mechanism for that semen, it doesn't matter very much if we've caused a lot of damage to the penis or the prepuce there, which the bull does want to scar down, as we all know if you've dealt with some preputial injuries. And again, it's just a banned substance that we cannot put into food animals. We can't get around that. Somebody asked recently, could we write to them and could we ask the government to take that off? And the reason why it's on that list is that with repeated use in mice and in several studies, it can cause some neoplasia. And so I told them, no, I don't think so. Once those drugs tend to go on that list, they don't come off. And so we can kind of forget about that. Lots of different exploration is going into looking for treatments, because this is such a significant loss to the beef industry. So these bulls are destined for slaughter if they do test positive. And so that we don't really have a way around that. Let's stop a moment and talk about testing and sample collection. The first thing that you want to do is make sure the bull is restrained properly. This is a picture of my friend Dr. Soren Rodning taking a sample, and most veterinarians in the United States are doing a dry aspirate or of the preputial lumen there, and trying to take a sample, a good smegma sample. A few things that I'll note that I think is very important, that you can cause some trauma here. I know a veterinarian that was sued for a development of a retropreputial abscess in a really expensive bull from a trick test. We don't want to be one of those. Not that I'm worried about litigation, but we don't want to, cause that type of harm. We do want to get a clean sample. So a few things that I think will help you as far as practice tips: restrain the bull properly. All right. You need to make sure that you're cleaning the area properly. Also, if there's a lot of organic debris, there's scuttleburrows down there, there's dirty hair, I tend to use scissors and I clip the hair around the preputial orifice there before I make entrance with my insemination pipette or whatever pipette I'm using, which I'll talk about in the next slide. In Europe, they're still douching the prepuce. That has not shown a difference in sensitivity. It's just really a veterinarian preference. But some people are using the newer raspers that are forming. I'm one of those, and I'll show you what I'm using. The old insemination pipette works just fine. And be careful about the way you're using it, again, because you can cause some trauma, specifically to the dorsum of the penis. I don't have a hand in this picture, but what I tend to do is open that lumen with a gloved hand and introduce the pipette to the lumen. And then I want to take my hand and really, as I'm extending that pipette back to the fornix area, I want to be able to place my hand back up and palpate that and move that around so I get the most surface area with that pipette to give myself the best opportunity of getting a good sample. And you may ask, what is a good sample? A good sample is a very cellular sample. When you inject it into the media, it becomes cloudy. And so there's lots of different things you can look in the literature and ask yourself, well, how much is enough? And I look at that clear media, that modified diamonds media, and I make sure that it turns cloudy and very cellular once I introduce that. I want to try to get a clean smegma sample. I don't want a lot of blood. There's some evidence in the literature that blood can interfere with the PCR. And so I don't want a lot of blood. I found that during my research, during my master's, that trick doesn't like anything. So it doesn't like blood. And we want to give ourselves the best opportunity to diagnose this protozoan. For the longest time, we've all thought that 2 weeks of sexual rest and then 1 week apart from our testing is the best way to do that. That comes from work in the late 70s, early 80s by a group out of Australia, where that became more consistent. The theory is there that it allows for this protozoan to replicate, and we get a better chance of diagnosing it. Dr. Ondrak out at in Nebraska is a colleague of mine who did a nice little study that he presented at AABP and also at the World Bariatrics over in Ireland, that says that maybe 3 weeks. They exposed a nice little study where they had a positive cow, and they exposed this bull, 3 bulls, to this positive cow one time, and they found that to consistently find that organism, it took actually 19 days. And so if you're really concerned about trick, maybe we should consider waiting 3 weeks. That was a smaller study, but it was also interesting that they only allowed that animal to breed one time, and they were getting positive as early as 1 day, but consistently we didn't see anything till out there about 3 weeks, 19 days to be specific. So really interesting work, and so I've started thinking about those things and talking to clients about that as far as timing when we should actually take a sample and test these bulls. Again, the discharge from the female is that post-coital pyometra. And then when you have an aborted fetus, the abomasal contents are really a good bet to submit to the diagnostic lab if you're not submitting your entire calf, or if it's an early run at death, you might not even be able to find that organism in the pasture. Here's the sampling devices I was talking about. Again, the oldie but goodie is and all of these work just fine. I looked all through the literature when I was preparing for this, and also I'd reviewed it with my master's extensively, and I can't find any difference in in the outcomes by any of these. Maybe somebody's doing some work out there right now. Maybe my group should do some of that, but we haven't seen any difference in sensitivity with any of these different sampling devices that are out there. I've been using the Pizzle stick from Lane Manufacturing recently. I'll tell you that one of the things that I don't like with it versus the old mare insemination pipette is that the lumen here is opaque versus clear. I can't really see that nice cellular structure, cellular smegma that I want to see, and it's a little bit harder to inoculate the end pouch with this. But what I do like about it is it's atraumatic. It does have its little holes here at different parts of the end piece there that allow me to apply some negative pressure and pull some of that smegma into the lumen and then wash it out into the end pouch once I get ready to inoculate the pouch. This is the old Tricamper, which is very much like the Pizzle stick by Lane. Here's a Tricket that was sort of got this rubber on the end of it here that allows to scrape over the dorsum of the penis, which actually in another study Dr. Ondrak did, they found that the tip of the penis is where we recover most trichomonads. And if you think about that, it's just the propagation of the species. So those trichomonads want to be out there where they're going to be delivered by the penis and to the cow so they can continue to carry on. But we can cause a significant amount of trauma on that penis if we get to scraping it too hard, and so it's a real challenge for us. But the Tricket allows you to scrape across the top. I've also heard about some veterinarians tell me, which is very interesting to me, about when they're doing a BSC, they'll extend that penis, and then they'll take a popsicle stick and they'll take some smegma from the dorsum of the penis and scrape it off into their media, and I think that may have some promise, but it still hasn't been validated in a study yet. But I do think, based on Ondrak's work, that does have some real merit to it. But that Tricket is that process there. It does have a nice hollow lumen there where you can apply some negative pressure, but we haven't done those studies to prove one is superior to the other at this point. The main thing I want you to take away from this is to get a good sample and make sure you try to do less trauma to the prepuce and the penis, and get it to the lab in a hurry. Okay, here's our sample transport. I'll talk about just briefly. That end pouch is what we use. It's nice and convenient. It's a modified diamonds media that allows for propagation of this organism, so we have a better chance of diagnosing it. The labs do a good job of diagnosing it. So it's not the test, it's us not getting the organism off the bull or not handling that sample well enough to get it back to the lab where they can actually diagnose it. So I'm slow about actually taking the sample, but once I take the sample, I'm in a hurry. I'm the hurry up, no huddle type offense after that. I want to get it there in a daggum hurry, all right? I also want to give you a little practice tip, and I want to show you my stupidity. So bear with me. But right down here, if you can see my pointer, there's an expiration date. All right. If you go out and collect a bunch of bulls like I did one time, and they had to gather these bulls from the back 40, and they were not the happiest of bulls to come to the pen, and you collect those samples and it's a month out of date, let me tell you what the lab's going to do. They're going to throw that in the garbage can, and they're going to ask you to get another sample. The producer is going to be really upset with you. So look at that expiration date. Another thing you don't want to do, it comes in these boxes, as you can see in the background. And the reason why is this media doesn't like light, and it doesn't like extremes in temperature. So you don't want it to ride around your vet box where it can get 115, 120 degrees in there in the summertime, even in Nebraska. Study done by Dr. Meredith Jones and Dr. Ondrak. Again, they presented that work, and that is not good for this media. If you read on there, it needs to stay at room temperatures, and so don't use media that's been running around your vet truck. After we inoculate it, remember this organism, this is a two-tiered pouch. If you're using the pouches, which a lot of people still are, there's other media sources now that are coming on board, but you need to talk to your laboratory and find out what they support as far as some of the different ways that they're diagnosing this now as far as the media goes. But We want to incubate this at 37 degrees C. This was supported in this paper in 1999. But I also want to set them up right. A little practice tip is to put them in a coffee cup. You can put them in a chicken egg incubator if you're out shoot side and testing a lot of bulls in one day until you get it back and get it to the lab. I want to ship this overnight. And again, I don't like trick testing late in the week because I don't want it to sit on the dock and they're not taking an aliquot at the laboratory. And so we tend to do this testing early in the week so we can get it to the lab during our normal working hours. Couple different tests. I told you that already. I let the cat out of the bag, that it doesn't really matter about the test. It matters how we get the organism off the bull, and also how we handle that sample once we get it back there, and also how many times we test these animals. And so the culture has been around for a long time. You can see how they do it. It's just a microscopic examination for the organism. 5 to 7 day turnaround time on this. It's very inexpensive is one of the pros to it, but you have to provide that environment for replication. So they're gonna stand this up so those organisms in the incubator, so those organisms can get away from a little bit of residual air there in the pouch. You want to try to get all that out that you can. Where we see some false positives is from fecal contamination. You can get pentatrichomonads that are normal part of the GI flora that can look like trick and can behave like trick. And if you're not have a keen eye with the laboratory personnel, they can actually call that a tritrichomonas fetus instead of a pentatrichomonas. Careful with fecal contamination, get that good clean sample. False negatives where the organism dies or we just didn't recover it on the way to the lab. Here's what they're looking for. This is the motility. If I can get my media is not wanting to play, and I even tried it before this happened, but it has a very herky, jerky, rolling type behavior to it. I'm sorry my video is not playing. If you're interested in that, email me and I'll send it to you. But this is some trichomonads we did not culture. We just recovered from a cow that had a pyometra at a dairy that they had turned out with some bulls, and we found it on a palpation reel. We actually found 2 that day, but this was uncultured, and again, I think that it was just teeming with trichomonads, which was nice for us to see, and I always wanted to find that, but it's the only time I've ever found that in my career. The PCR, the sample is going to be the same. We can actually take the same an aliquot from the same in pouch and do a culture and PCR in parallel. If you're just testing once, which most clients only allow us to test one time, that does increase your sensitivity, specificity. But we're looking for that organismal DNA as obvious in any kind of PCR, and really the pros of it's a 24-hour turnaround time. We do see some false positives from organic material, but that really with the increase and better primers that are available now, we just don't see that as a big problem. False negatives would be we just did not recover that organism. We find in one unpublished study that bulls there's variation between bulls. Some bulls are going to be low shedders always, and some bulls are going to be high shedders where we can always find that organism. And then some are intermittently found, particularly those low shedders. It's just difficult for us. That's why it's so critical and a challenge for us to get a good sample every time to try diagnosis and increase the number of times that we test them. Okay, so here's the end all on testing. What test and how often? Okay, so a single test has a low sensitivity. Actually, in essence, if we had 100 bulls and they were all positive, and we did one test, no matter if we use the PCR or the culture, we're going to miss about 20 of those bulls. Okay, and so the sensitivity is about the same with one test as far as the PCR and the culture. We thought that would be different, but it's not. The PCR is a little bit more specific than the culture. I always recommend at least 2 weeks of minimal sexual rest based on that work by Alndrock and others out in Nebraska. I would suggest that 3 weeks would be better if we're really concerned about trick. You're in trick endemic area, or you have some of those, real characteristic signs of trick with increased interestrus periods, decreased calf crop. with 1 week apart. Now, CSS is going to go one step further than that. CSS being a quality statement. If any of you work for Bull Studs, you'll know this, but Certified Semen Services, they're actually going to test these rascals 6 weeks with 1 week between each test to be certified semen services, because this and also the next organism we're going to talk about, Campylobacter, do survive cryopreservation. So they do not want to disseminate that through an AI straw throughout the world. And so they're going to go to really great lengths to make sure that we test them. But my take home message, you got to get the organism off the bull and get it back to the lab in a dadgum hurry. All right. Handle that sample well, and then you'll have the best opportunity to do that. If you can, get those owners and talk to them about testing multiple times. The more you test, the better opportunity, the higher the sensitivity that you'll have. So I recommend 3 times 1 week apart if we're really concerned about trit. Here's some control strategies. If you do have a trick endemic herd, testing the bulls, like I was mentioning, you can cull all the bulls. That is not a financially feasible plan for a lot of people, because that can be very expensive. But if people are really concerned and their risk assessment of it is they want to get rid of it, then that is a good way to do that. Culling all the open females would also be that. That way, they may be harboring a trick infection there, and so culling those open females is again something that's not too appetizing to the wallet. But moving those females into a separate breeding season is another option for you as well, where I would use the same bulls. Those bulls that were assigned, that takes really good record keeping if you're going to maintain those separate herds and not cull those open females. And a lot of states require those bulls to go to slaughter, so that's not even an opportunity for you anymore. They need to get out of there. But in any population of bulls where you have a positive test, you can almost bet you're going to find more positives if you keep testing, and that's just the nature of this organism. And so vaccination is something I definitely recommend. There's one on the market called TrickGuard. Let's look at the label real quick. And it's like most labels for biologicals that we have for cattle. And it says for the vaccination of healthy cattle is an aid, and I underline aid in the prevention of disease caused by Trichomonas fetus. It doesn't mean that we're going to totally eliminate it and the organism is still going to be transposed during coitus. But understand that it will reduce the pregnancy loss, and some of those cows that do lose their pregnancy, it's going to hasten their return to breeding soundness as far as them getting over that infection and mounting a temporary immune response. The problem is that it's not going to be 100% there efficacious, just like any vaccine, but I don't recommend this in every herd, but in endemic herds, I do. It requires 2 doses like any kill product, where that second dose in the initial regimen of vaccination, where that second dose should be administered 4 weeks prior to the breeding season. Now, if they can't accomplish that, if they're vaccinating way back at preg check, it's probably just best to put that money somewhere else, because it's not going to be beneficial to the operation. So you gotta see what they can do, and it does have quite a long withdrawal time of 60 days. So take that into consideration when you're recommending this vaccination. Some other preventative strategies, if you want to really eliminate it, you can go to total AI. That is a way with CSS semen, which again, they've gone through a litany of testing there to make sure that they do not have this organism in those bulls. Maintain a young bull battery. Again, the older the bulls, the more likely they're going to become a chronic carrier. And then isolation protocols. Okay, anything. I don't trust any bull when somebody tells me they're a virgin until they're tested. I just don't do that. Any open females, I want to make sure I have strict isolation protocols and some testing to go there on those bulls before they're commingled for sure. And then that limited breeding season is going to allow to not disseminate that organism so freely across the herd, and allow you to also monitor more closely and see if you actually have a problem. You can get some, if you got a limited breeding season. Dr. Larson talks a lot out there at K-State about, some calving distributions, and it can lead you to believe, some of the problems you may be having, and try to solve those much easier if you have a controlled breeding season. Also, from a preventative standpoint, it's so much easier to maintain their health. Where I was in Florida, lots of opportunities for bad weather there, like it is here in Louisiana with hurricanes. And so in large herds, it makes it more difficult, and also the western range states. But good fences make good neighbors. So you may be doing everything you can, but if you've got those, cycling heifers right next to your neighbor's fence, and maybe your fence isn't too great, but love knows no boundaries is what I like to tell my students. And so that bull will find a way to swim the river, to get over the fence, and get to your animals, those cycling females. So it may be best to move those cycling females, if possible, away from a pasture that's exposed to the fence line to the neighbor, to minimize that exposure, so you don't chance that but it's still an opportunity for a break in biosecurity there, even if you're doing everything right. That's a challenge. And then I want to institute that surveillance program if I'm in endemic areas after the breeding season. I want to test them with about a week or two of sexual rest, allow for replication of that organism, and then prior to the next breeding season during the BSC is a great time. You got the critter in the chute, so we can test him for Trichomonas fetus. Moving on to our second. I'm running out of time here, so I'm going to hustle up a little bit. And the good thing about Campylobacter is there's not a lot of differences. We're going to see everything very similar to Trick as far as the presentation. As a matter of fact, if you have some of those clinical signs or history that we were talking about earlier, increased interestrus periods, decreased calving rates, Campylobacter has to be on your list with Trichomonas fetus as far as your differential. But the organism is Campylobacter fetus subspecies venerealis. It's a gram-negative, common shaped rod. It like Trick does not like air. It likes a microaerophilic environment, and it has this darting type motility that you can see on dart field microscopy if you're using that modality to try to diagnose it, which is usually from abomasal contents, possibly from an abortion, if you're in a diagnostic lab. The disease is called three things. Campylobacteriosis is what we use, but you might hear it called Campy, or the old term where it was first named in the early 30s called Vibrio, and it still holds true in those multivalent vaccines. The same thing you would see in Trick, you see with these with Campy as far as the bull. He's an asymptomatic carrier. He spreads this disease through coitus, localized there on the penis and the prepuce. Like Trick, it's not locally invasive. And we tend to see it and older bulls become more chronic carriers. And again, we don't really understand why that cryptic conspiracy has been disproven by that work by Dr. Lou Strickland. So don't really know. That's not really fully elucidated yet, but that's what we tend to see in the literature when we look at these guys. Very similar here. The one exception here that's a little bit different, you can see some second trimester abortions sporadically with Campylobacter, and so nothing really other different than that than Trick as far as what you're seeing in the cow: increased interestrus periods, decreased calving rates, and then lighter calves also are going to cost the producer a market share of money. Treatment, dihydrostreptomycin is not available. It was effective, but it's really off the market now. So the lack of availability of that makes it difficult. And then we're going to talk about immunotherapy in the next slide. Trailermycin is what one of my mentors always talked about. So I got this punch hole Wilson here. You could put them on the trailer if they're open. Even if you diagnose it, they're still an open cow, and sometimes that cost of the operation in certain years and certain cow markets might cause them to choose to market that animal for beef. How are we going to diagnose it? Same collection sample as Trick. Matter of fact, we can take that smegma sample. I do it at the bull stud, and we're going to inoculate the. We're using. You can use a variety of media to enhance that organism. Carrie Blair, Amy with charcoal, Amy's without charcoal, Skiro media, and then the classic one that we learned about in school was Clark's. The main thing is it doesn't like air, and so you want to create an anaerobic environment to propagate this organism. If you are using Clark's media, that usually preputial wash is more commonly to inoculate the media because of that smegma being so thick. But we're using the swab here with Amy's with charcoal. You really need to. It really highlights that you need to talk to the lab that you're utilizing and find out how they want that sample collected and what medium they want it transported in and how they want it transported. So, but the same, using a dry aspirate usually for this organism now in most occasions. There's an ELISA available on vaginal mucus. Culture is sort of difficult with this organism. It requires a special environment. And you can do a gram stain. That usually a gram stain is going to be utilized for a fetus that's been aborted on abomasal contents, and there is a new PCR available. So take home point, there's many different ways to transport this. Call your lab and have a good relationship with them so that you give your chance the best opportunity to diagnose that. Prevention, management is the same as trick. We're control breeding season, so you can look back at that slide and see the same things. The difference here is the vaccine. Okay, so there's two available here. One being an oil-based adjuvanted vaccine, the old one called Vibrin, as you see in this picture, and then we have this multivalent vaccine that's adjuvanted with aluminum hydroxide. This is much superior. The old Vibrin, oil adjuvanted, it will cause some a granulomatous type reaction sometimes, and so be careful in show animals if you're given this. It will cause a pretty good sized knot there. But it's been shown in the literature to be both prophylactic and curative. So if I'm working with a Campylobacter herd or an area that is endemic for that, this is definitely the product that I'm going to use. It's really a 2-dose regimen, and again, 3 to 4 weeks is the last dose prior to the breeding season is what they recommend on the label. Bulls, we use 2.5 times the label dose, which turns out to be 5 milliliters. And it's shown to cure or clear those bulls for up to 9 weeks or longer in the literature. And so if this immunotherapy is definitely something that's different than trick that helps us. And also we just don't tend to see in this country, we don't see the prevalence of Campylobacter like we do trick. It is very prevalent, much still prevalent in some South American countries if you look into the literature. We got about 5 minutes, and I'm gonna quickly talk about Bovie's herpes virus 1. A couple viral entities. We're changing gears a little bit from a bacteria and a protozoan to a couple viral entities that definitely can cause some infertility in beef herds. We've traditionally thought about IBR as causing a significant amount of inflammation. Its lay term is red nose, as we know, but you can see ocular, respiratory, and definitely reproductive signs. And then we know that it can go latent in that trigeminal ganglia, and then during times of stress, be reactivated. So acute infections, a latency, and then reactivation are definitely something that we all know about. But from the reproductive standpoint, it can cause infectious pustular vulvovaginitis, infectious pustular ballonophthalmitis in the bull. And then we can see this necrotizing oophoritis, where we see this. So if we have where that virus is replicating in the bloodstream around the time of CL formation, when we got a corpus hemorrhagicum, you can see focal necrosis of that CL, that forming CL, and in turn lysis of that CL, because lack of progesterone being produced there to maintain the cycle there. So definitely a decreased quality of luteal tissue because of that infection there that could actually cause us early embryonic death or pregnancy loss because of lack of progesterone environment to support that. Obviously, placentitis. This organism did not. This virus did not get a lot of attention for the longest time in the literature because of brucellosis that caused so much placentitis, and because it being a human health risk, it really was overlooked for a long period of time. But it can cause a significant amount of placentitis in the animal and cause abortion, but it's not. It's going to be some time after we first see that we see these associated with abortion. Up to most abortions are going to occur several weeks later after the initial infection. So you can see aborted fetus from 5 months to term. Usually these fetuses are going to be autolyzed, and you may see a red tinged fluid in the body cavities if you do a necropsy on these animals. And so anywhere from 2 weeks to 2 months post infection, and again, usually an autolyzed fetus. And unfortunately, even with paired titers on these animals on the dam, you're going to see a declining antibody titer in the female if you're taking samples to try diagnosis. Here's a little poll question, our last one of the night, I think.
Okay, I've got the results.
Yeah, I think everybody pretty much got that. So this is, infectious balanoposthitis. The bull is quite painful to the bull, but with sexual rest in a couple of weeks, those pustules will resolve, and he will actually go back to breeding. So the answer was sexual rest for 2 weeks. And so with IBR, that's separate from the respiratory form. Here's the, we see pustules and papules in the vulva, the vestibule, and along the penis and the prepuce that are quite painful. You can even see pain upon urination. Usually I don't see fever, but you can, it's noted. And you can see this from nose to genital contact. And from a venereal standpoint, it can be passed that way. But luckily for us, it does with sexual rest. And one of the things we recommend that we're about to get into is to vaccinate these guys with a modified live pre-breeding at least 30 days prior to breeding to try to avoid the respiratory and the reproductive consequences of this virus. Moving along, just wanted to mention bovine viral diarrhea virus. I'm from Auburn, and so I have to talk about BVD, I think. It is an enveloped single-stranded RNA virus. It's a pestivirus. Also, other pestiviruses that we see are going to be classical swine fever virus, or cholera, or border disease virus. We got those 2 types of BVD. One of the characteristics of this virus is that it has a high mutation rate. The transmission it can be either vertical or horizontal. The horizontal transmission is from PI animals or transiently from an acute infection, but you can any kind of secretion coming from this animal, particularly a PI animal, is highly infectious and easily passable to other animals in contact with them. So that's why it's so dangerous. The PI animal is the most is the animal that we want to find on the operation to try to eliminate, because they're spewing virus everywhere. Through and then we can get this through inhalation and ingestion, through any of these nasal secretions, urine, feces, milk colostrum also is effective, saliva, any kind of ocular discharge, and also semen. Okay, we've seen bulls that were infected, and they don't tend to have a long-standing infection. They tend to clear it eventually from their semen, but it's something that you want to take in mind if you're trying to eliminate BVD from your client's herd, making sure that those bulls coming in are actually negative and not actually a PI or persistently infected animal for BVD. Vertical transmission, when a pregnant animal is exposed to the virus, really the outcome depends on the stage of gestation, and we'll get into that in the coming slide. So, what do you see with BVD infected herds? And we overall, I think about this. We should not have called this BVDV. We should have called it bovine viral immunosuppressive and reproductive wrecking virus, is what I like to call it, because we see overall a significant reduction in reproductive performance, either through early embryonic death or abortions, just chronic infertility. Increased calf morbidity, mortality, you get more stillbirths, you get definitely immunosuppressive action. So congenital defects like you see in this with cerebellar hyperplasia, microophthalmia, a litany of things associated with the head and the neurosystem. We get reduced weaning and growth weights of these calves. Are not going to perform ever to what they should. And then overall, we can see, an incidence of mucosal disease, where we can actually have a significant increase in mortality and morbidity there with that. We have a homogeneous infection there of the non-cytopathic strain and the cytopathic strain. And then an overall increase of bovine respiratory disease in these herds that are positive. They've even seen it in the feedlot where we have adjacent pens. We've got a PI animal in one pen. Overall, we're going to see a decreased production in the adjacent pens, and also increase in pulls in those pens, increased respiratory disease. Quick question here. I don't have a poll here, but which one, this is from Auburn, which one of these you think is a PI animal or persistently infected with BVDV? If you say the one on the right, you would have said what I said when I was a student. And I thought this one, he's that poor doing calf, that pot-belly looking hairy calf. Actually, this limousine on the left is actually the persistently infected calf. This calf is just a poor doing calf, but you really can't tell phenotypically, even though we have our suspicion as veterinarians sometimes when we see these calves come in. Most PI animals are not going to live past 1 year of age because of the severe immunosuppression, but we definitely can see this, and this animal here is again shedding virus very efficiently. Here's the two types. We have two biotypes of BVD, and then that's broken up based on how they affect cells in culture in vitro with the non-cytopathic strain and the cytopathic strain of both types 1 and type 2 of this pestivirus. The non-cytopathic strain is the strain that causes the only way that we get a PI animal if exposed at the appropriate time before immunocompetence during gestation. Here's the consequences of the in utero BVD infections, and I'm almost out of time, or I am out of time. So I'll stop it on this one and answer any questions that we may have. But here are some of the consequences of in vitro. So we get early embryonic death. We can have abortion at any time during gestation. From 40 to 120 days before that animal is immunocompetent. If we're exposed to the non-cytopathic strain, we can get that persistently infected calf, and that's where it's real dangerous. And when we're purchasing pregnant animals of unknown history, that's when we can really bring in a wreck to our operations. From 125 to 175, depending on when organogenesis is just completing there, we can get a litany of congenital malformations. Again, cerebral hypoplasia is one of the most common, microphthalmia being another. And then late in gestation, if they're exposed, we can get an acute infection where they can mount an immune response and then shed that and not be effective. Those calves can be born normal if they're infected late in gestation. I'm going to stop there because I'm out of time. I talked a little bit too much about trick, and I apologize about that. But I guess, Carla, do I need to turn that back over to you?
Actually, if you want to, I will just say that keep an eye out for the recording probably later on tonight, and there will be a message board thread here at the very end where you can post more questions. But I say let's go ahead and take a few questions. If you want to look in the chat window, you'll see what folks have been asking.
Let me go back here. There's probably some good questions here. Is there evidence of reduced fertility associated with T fetus in cows even after recovery from disease? Well, it depends on good question, Ali. It depends on when you look at that. In those first 15 months after they clear the infection, there is a temporary temporary immunity there where they will actually can fight that infection off or any kind of negative associations with the infection from T fetus. But after that, you definitely can see some reduced fertility. Again, you start that over after that 15-month period after they clear the organism. Tricia asked, why is a dry aspirate better than putting a balanced, I assume, salt solution in the prepuce, holding off the orifice and massaging along the length and then collecting the sample by gravity flow? There's nothing wrong with that. I typically, you're going to use some type of saline if you're over in Europe. Again, if you look into the literature, you're not going to find any difference in sensitivity. So that douche is just fine, and we don't see any difference in sensitivity with that. Mainly, I just want to get a good, clean sample and get it back and handle it to the lab in an efficient manner. Dr. Gunn has produced a YouTube video. What factors are used by the company to establish the shelf life in pouches? I can't answer that. We'll have to ask somebody from the company. It has a fairly long shelf life, and so I just encourage you to make sure you look at the date and don't do what I did, because the owner was pretty upset with me. I'll never forget that one. What percentage of 12 to 18-month-old versus 4-plus-year-old bulls are able to spontaneously clear? It's hard to say a prevalence of that. We just know that younger bulls are more likely to clear the organism than older bulls, except I don't bet on that. And again, I caution you about that because clients want to hear what they want to hear, and that can be very risky in trichotillomanic areas. Okay, why does organic debris reduce the accuracy of the PCR? PCR is used for fecal samples of cats to track. Is TrickGuard given to both bulls and females? That's a good question about the TrickGuard. I'll address that first. TrickGuard is labeled. If you look at the label, it says for healthy cattle. It doesn't designate that. And so when I was in Florida, I had a group of producers that really believed that they could vaccinate themselves out of trouble with the with using TrickGuard in his bulls and their females. So far, the literature has not supported that, and we haven't done real challenge study. It's been something I've been wanting to do, but we don't know at this point if that's actually beneficial in bulls. So far, the preliminary data and the small studies that we saw have not supported that in bulls as far as eliminating the risk of using those positive bulls if those critters are still running around. Dr. Thompson talked. What are my opinions on the sponge testing for T fetus? I think if you get a good sample, and there's some merit out there from Iowa State. Dr. Grant Duell did a nice little report on they were taking a sponge and actually, but a lot of the problem with that study is a lot of labs aren't supporting that at this time. It may be something, again, Dr. Ondrak's work would suggest that we have a much better chance of diagnosing it at the tip of the penis with a smegma sample. So that may be something that comes into favor and validated by many labs as we move forward. So you look for that. I think that was some good work that was done. It's just we're slow to change, but it's something we need to continue to sharpen our skills on, because trick is you guys can always email me. And so if you have any questions, please reach out to me.
Okay, thank you ever so much, Dr. Armstrong. Thanks to everyone who stuck around, asked some excellent questions. I did pop a message board thread link there in case anyone thinks of anything later. And don't forget to check your email tomorrow for a link to the survey to get your CE certificate. Thank you, everyone, and have a lovely evening.